Welcome everyone. Today is a very exciting day as we launch our first research salon for WeProsper. We will be focusing on childcare today, which I'll get into the reasons behind that here in a minute. Looks like some people are still joining, so welcome to everyone who's logging on. In terms of, let me make sure I can actually move my screen here. Oh, there we go. In terms of our agenda for today, I'm going to provide a little bit of an introduction to the rationale behind these research salons, what we're hoping to accomplish with them, and what they're going to look like going forward. Then I'm going to provide a short overview of the childcare findings from the WeProsper Care Services report that was released at UNGA. Then we're going to have 4 research presentations today. We're going to hear from the Center for Global Development, the Abdul Latif Jameel Poverty Action Lab, otherwise known as JPAL Global, the Initiative for What Works to Advance Women and Girls in the Economy, IWWAGE, and Uthabiti, Africa. After that, we're going to hear from 2 really amazing discussants who are powerful advocates. We're going to hear from ActionAid and Oxfam International. And then at the end of the session today, we're going to have a chance for Q&A. So we're really excited to hear from you all, give you a chance to ask questions, and really hopefully spark a really active discussion around the research and as well as these kind of research and advocacy connections. So this is the headline for today. Our technical working group is launching these research salons. I think one of the really incredible things and the unique things about our coalition is that we have such a mix of members, right? We have a bunch of advocates operating from the grassroots to the global level. We also have a really powerful research base, including academic institutions, think tanks, all sorts of researchers. So as we stay true to our mission of evidence-based advocacy, we've really been strategizing within the technical working group. How can we make this research available to you all so that you can use this in our advocacy and so that we can kind of reflect on this together to make our advocacy messaging really strong at the kind of collective level. So the purpose of these sessions then is to share the really interesting and important research of technical working group members on key thematic areas, and to expand the knowledge base again of all of us, right, and to strengthen our collective advocacy. So the format, as I kind of laid out before, we're going to give our researchers and our technical working group members opportunities to share their research in these sessions, and then also bring in discussants, right, who are working on advocacy on these issues so we can make these connections and really figure out how to take this forward in the most effective way. Following these sessions, there's also going to be written briefs that we'll create that will kind of summarize the key takeaways. This way you'll be able to kind of cite this and use this in your work going forward. So our future sessions, we're going to continue these. This is just our pilot one this time, and we're going to be taking this forward. So a reminder that, the key thematic areas that came out of our advocacy strategy are gender data, care work, informal economies, decent work, and economic rights. So these are obviously still, kind of big buckets of issues, right? And within these, we can start to pull out some really specific areas, as childcare is kind of one bucket under care work, so that we can get more specific, right? We want to bring specificity into our conversations about these issues and be able to really use that in a powerful way to make informed policy recommendations. So technical working group members were particularly interested next in going to gender data. So we're going to look forward to our next session. Hopefully we'll be kind of landscaping that with some key partners who are doing work in that area. For those of you who have not yet seen this report, I think Kelsey's going to kindly share this in the chat for us. We released this at UNGA, as well as the kind of policy brief summarizing some of the key takeaways and kind of policy implications. But within the technical working group, we're again hoping to start to synthesize evidence on key issues, to use that evidence base to inform our recommendations. So we started with care services, as again, there's kind of a lot moving in the area of childcare, but we also wanted to bring in a focus on long-term care. But as the focus of today's session is childcare, I'm going to give an overview of the findings related to that. So the goal of this report was to synthesize evidence that could be used by advocates and to really think about how we make a case to policymakers for gender responsive policies and investments in care services. So to do that, we really evaluated the extent of the provision gaps. The whole report focused just on low and middle income countries. We wanted to look at the costs of filling those gaps. What does this take in terms of investment from governments and from donors, and also the benefits of filling these provision gaps, particularly with the focus on quality and affordable care services, and providing at the same time decent work for childcare workers. So in that way, we looked at the kind of the baseline, right? Where does financing stand at the moment? What is the domestic level of financing and where does donor financing lie? And we also looked at domestic and foreign policies, particularly with this women's economic empowerment lens, right? What are the policies that have been evaluated with regards to impacts on women's economic empowerment related indicators? And what does the evidence say? So I'm not going to spend too much time on this because hopefully, you've all had a chance to see this and we'll hear from others, but I want to give some kind of highlight level takeaways. There we go. So what we found is that there's going to be significant expenditures required to fill childcare provision gaps, as these are really large in low and middle income countries. But these types of investments would generate significant levels of employment, particularly for women. And they would also offer fiscal returns, right, that would offset these expenditures. So what we mean by fiscal returns are revenues for governments, right? And that often comes in the forms of tax revenues. So we summarize, there's these kind of what they're referred to as costing studies. And what these studies do is look exactly at what costs it will take, what are the costs that are required to fill to accommodate provision gaps. And there's a lot of studies. This is kind of a burgeoning area of research. And it really depends, right? For some countries, the kind of levels are lower from particularly high income countries, up to really high levels for some, such as the United Republic of Tanzania. However, with the employment effects, we did see that women would see up to 90% of the employment gains, because we know that care service jobs are often have high levels of gendered occupational segregation, meaning that women are kind of clustered into these sectors. However, again, these fiscal returns often would be, they would really help offset the cost of the investment. So they're estimated to range from anywhere from kind of like 10% up to 70%, right? Which is really high and shows that there's, these can be really effective investments. In terms of evaluating the kind of the baseline levels of financing, we did find that the levels are quite low, though perhaps higher for childcare than for long-term care in most countries. We also found that official development assistance was pretty low as well, in terms of particularly prioritizing kind of standalone programming for childcare. However, it is becoming an increasing priority in international financial institutions. This is reflected in the IDA20 replenishment, as well as the World Bank's Invest in Childcare initiative that we'll hear more about today from Fiana. So yeah, on average, there's really low levels of spending. So there's a lot of different kind of components to childcare that you can think of in terms of expenditures. Some of that is, pre-primary education or preschool. And on average, low and middle income countries are only spending 25% of what was necessary to meet Sustainable Development Goal targets. And in terms of official development assistance, we only saw that 0.7% of that went to early childhood education. However, they kind of, again, highlight high-level takeaway is that providing quality and affordable childcare was a highly effective way to support women's economic empowerment. Probably not a surprise to most of you on the call, but what we did see is there's just a really robust evidence base. There's a lot of different methodologies, some of which we'll hear more about today, across a wide range of programs and policies. And we do kind of summarize those for you in a table in the report. And there's also, evidence around not just labor force participation, but other aspects of women's economic empowerment, such as the gender pay gap. Lastly, as we think about how to make effective and kind of compelling cases for policymakers, right? We want to make this from the rights-based angle, the kind of gender equality angle and women's economic empowerment, but also we're showing that these are, again, ways in which they're also strategic economic policy decisions. I think many of us probably don't want to have to make the case that way. And would like governments to just respond to the kind of, women's economic empowerment, rights, human rights angle, but there is compelling evidence that shows that these investments in care services, which are sometimes referred to as a form of social infrastructure, have different impacts than traditional infrastructure investments, in that they can create more jobs. That's showed in these simulations from Turkey and the Kyrgyz Republic, where they create 30% more or 2.5 times more jobs than construction. The majority of these jobs would go to women and the unemployed. They would be able to create more decent jobs, greater reductions in the poverty rate, and higher rates of self-financing. So this is something, again, messaging that we can use in our advocacy to say this, there's ways in which governments can think about these investments as meeting a lot of different goals, and the same for donors. So now we're going to be turning to our speakers for today. So we are going to hear from 4 researchers. So from Shelby Bourgault, Megan Morris, I just said your name wrong, Shelby, we're going to ask Shelby Bourgault, Megan Morris, Shreya Ghosh, and Asayya Imaya. So first, I'm going to stop my screen share. And then we will also be hearing, as I said, from Wangari and Fiana in terms of the advocacy angle. So we're going to kick it off today with hearing from Shelby Bourgault from the Center for Global Development. She is a research associate there, and her research focuses on care work, women's economic empowerment, and gender and the work of multilateral development banks. Prior to CGD, Shelby worked at the International Center for Research on Women, she's an ICRW alumni, where she focused on women's livelihoods and labor issues. So today from Shelby, we're going to hear from she's going to present preliminary findings of an ongoing review of the evidence on childcare's return on investment, some of which I was getting to in our report as well, but she's going to flesh that out a little bit more for us. The motivation here is to help policymakers understand the potential returns on investing in childcare, including outcomes such as increased income to women and eventually the children themselves, increased tax revenue, and increased GDP. This review is going to map and take stock of where evidence exists and where research gaps remain, which I think is a really key thing that we can bring out of these research salons is where is additional research needed. So with that, I will turn it over to Shelby.
Thanks, Mary. Okay, let me get my screen set up. Okay, great. Thank you for that introduction, and thanks for the whole ICRW team for organizing this research discussion. Really excited about it. So as Mary noted, I'm going to be presenting the very initial findings from a literature review that we're doing on the evidence of childcare's return on investment. Oh, and now it's not moving. There we go. Okay. So this originally started from a workshop, a series of technical workshops that CGD and the World Bank's Early Learning Partnership put together in June of this year that was focused on childcare, and it brought together researchers and experts to discuss the investment opportunity of childcare, what works for whom, and the existing policy and financing landscape. Through these workshops, it became clear that the research existed on the return on investment of childcare, but that no one had systematically mapped that evidence yet. So we're conducting this literature review as a way to gather that evidence and build a stronger case for increasing investments in childcare infrastructure, and to demonstrate the fiscal value of these investments across contexts and where government budgets are already quite limited. So we conducted our search on JSTOR, ScienceDirect, Scopus, and Google Scholar, looking for papers published since 2010. And we included 2 groups of keywords, the first around childcare and the second around the return on investment, in order to capture papers that had both aspects. The full list of terms will be published in our final paper when that's out. And through the search, we noted that there were many papers that examine the impact of childcare on women's labor force participation and on the number of jobs created, some of those papers that Mary just outlined. But that few papers go that extra step of determining what the return on investment might be. And here we define ROI quite broadly to include not only the return to the government in the form of tax revenue, but also including returns such as increased income for individuals, increases to GDP, and analysis on the cost benefit calculation of these programs and interventions. So through our search, we identified 27 papers that did take this extra step and included some estimation of the return on investment. Over half of these papers were simulations, usually macro, but some of them were micro-macro. And another quarter employed a quasi-experimental design, and finally 1/5 of these papers were RCTs. Most papers, and especially the simulation papers, analyzed ROI related to imagined or actual increases to public provision of childcare, and 41% estimated the returns on vouchers or subsidies to private provision. The spread of our sample is fairly geographically diverse, but there is a high concentration in wealthy countries, and in particular Australia, where we saw the highest concentration and 4 papers. Overall, 42% of the included papers are in high income countries, 34% in upper middle income countries, and 27% in lower middle income countries. In our search, we found no papers from low income contexts, so that's clearly a gap in the research. Moving on now to the actual ROI findings of these papers. They show mixed results for the return on investment for individuals. All the papers that calculated changes in maternal employment agreed that it would increase from the low estimate of, 6% in Chile, up to the highest estimate of 27% in Brazil. The evidence was less clear, though, regarding changes in income. So studies in, Australia and Brazil showed an increase in maternal income, a significant increase in maternal income. But studies in Chile and Ecuador showed no increase at all. And for those studies, at least one of them demonstrated that women were moving out of self-employment and into more formal wage employment, but that the income didn't increase across that move. And in Turkey, Nicaragua, Kenya, Mexico, and Vietnam, there were either an increase in household income that wasn't further disaggregated, so we couldn't determine if it was the mother's income that was increasing, or there was only a slight increase in maternal income. Evidence on the return on investment for the state. So for this, we included calculations related to tax revenue generated from these childcare investments, as well as calculations of direct costs and benefits of these programs. So in Quebec, the UK, Australia, and Colombia, the economic benefits exceeded the costs of the models that were used in the papers, showing that these investments can be self-funding and sustainable over time. But again, it's specific to whatever models these papers employed. But that in Uruguay, South Africa, and Turkey, the cost of the investments may only partially be recouped through increased tax revenue and economic activity. So sustainability of those investments could be an issue. Finally, all the studies that included estimates of GDP change as a result of investment in childcare agreed that GDP would increase dramatically. So for this, estimates range from the low end of $2.6 billion in Scotland to $5 billion in Quebec, and then somewhere between 11 billion and 27 billion in Australia. There are, of course, constraints with doing this type of ROI analysis. And the first, not that this group needs to be told that we should be suspicious of GDP and growth estimates, but of course, relying on these numbers is problematic. Presumably, most of the estimated increases to GDP are generated from women who were previously doing unpaid care work, which is not counted in GDP, now moving to paid work, which is. So in many ways, this GDP estimate is an artificial estimate of economic activity. But we do believe that these types of estimates can be usefully employed to convince policymakers to invest more in childcare. Another constraint is that these papers use very different methodologies, looking at different types of childcare provision and use different estimates of ROI. And so it's very difficult to make comparisons across these papers. But finally, these initial findings can guide us to a useful research agenda moving forward. Number one, there are many gaps to fill in the ROI mapping, including across geographies, particularly in low-income contexts, and contexts with different demographic characteristics, such as places with very young or very old skewed populations. Number two, it would be great to further assess and improve comparability across these studies and be able to group findings more easily and determine what types of models work in different contexts. And number 3, for the final paper of this work, we will collect evidence about the alternative investments for a comparison case. So ideally, we would be able to make the case to policymakers that not only does this childcare provide great economic returns on its own, but that it provides better economic returns than perhaps military spending or other maybe infrastructure or other areas. And that is all I've got today. So thank you all so much.
Thank you so much, Shelby. I think that's a really great way to start us off in terms of thinking about these kind of macro level impacts and how we can make these types of cases again to policymakers building on this. So we'll look forward to that research as it continues to develop. I am next going to turn it to Megan Morris. Megan is a policy manager at JPAL Global, where she manages the gender sector. There, she synthesizes lessons from the global evidence base on gender topics and works with NGOs, foundations, and policymakers to develop research partnerships and support evidence-informed policymaking. She also supports JPAL's efforts to grow and diversify its research network. Today from Megan, we're going to be hearing about high-level findings from the growing evidence base of randomized evaluations on childcare and women's economic empowerment. She's then going to zoom in on 1 or 2 specific studies conducted by JPAL affiliates to present some more detailed findings. So today we're going to be going kind of from global, kind of macro level down into some more specific case studies. So thank you, Megan. Turn it over to you.
Thanks, Mary, for the introduction. And thanks to all of the WeProsper Coalition members for the opportunity to learn and share with you today a little bit about, as Mary mentioned, some threads and findings from the randomized evaluation evidence base on childcare and women's economic empowerment. So let me first just begin by giving a really brief overview of who JPAL is and what we do. JPAL is a network of affiliated researchers that are based at their home universities around the world. And these researchers are conducting evaluations to try to understand the conditions and causes of poverty, and then to tailor solutions to tackle these problems. So at JPAL, we conduct rigorous impact evaluations, and we specifically specialize in randomized evaluations, or RCTs. Our network of affiliates have carried out more than 1,000 randomized evaluations in countries around the globe. And then our policy and communications team, and that's where I sit, we look at the vast body of research, we try to find cross-cutting themes, and then we pull out policy lessons to inform future programs, policies, and policy and research discussions like our discussion today. And then at JPAL, we have 11 different sectors. And today I'll be drawing evidence from largely from our gender sector, but also, of course, these themes come from the labor market sector as well. So let's just dive right into kind of some of the evidence based on randomized evaluations of childcare. So as everyone in this room knows, women often bear the majority of household and childcare responsibilities, and that can really hinder their employment opportunities and their productivity. So 2 potential pathways through which childcare could improve women's economic agency are by freeing up women's time to participate in the workforce, or by allowing them more productive time at work or in their businesses. Of course, there may be other pathways. For example, Mary spoke about like promoting employment opportunities for caregivers who are often women, but these areas definitely still remain open for future research and evaluation. So let's first look at the first pathway I mentioned of childcare and women's employment. 4 randomized evaluations of free and subsidized childcare come from Brazil, Kenya, Nicaragua, and Chile have found that childcare increased women's labor force participation. The evidence from these studies also suggests that childcare may increase income in some settings, and likewise, in some settings, the results were long-lasting. However, before I'll go into kind of examples of some of those studies, I want to note that childcare may not increase labor force participation in all contexts, because the care burden may not be the only limiting factor for women entering the workforce. So, for example, a randomized evaluation conducted in India found that childcare had limited impact on women's work, and researchers suggest here that limited employment opportunities in that community may have hindered the effectiveness on childcare on women's labor force participation. And then, of course, we also know from the wider evidence base on women's agency that restrictive gender norms often mediate the impacts of programs and policies, right? So it's definitely possible that gender norms may also mediate the impact of childcare on women's ability to enter into the labor force. So the relationship between access to childcare and norms around women's work is certainly something that future research can examine. So let me begin first with an example from Brazil, where a JPAL-affiliated researcher, Horacio Atanasio, and his co-authors evaluated the impact of a free public daycare on households and caregivers' economic outcomes. So this program provided a holistic program of full-time daycare and other interventions such as food, health services, and toys for children aged 0 to 3 in Rio de Janeiro's low-income neighborhoods. The researchers found that access to public daycare in this case increased mothers' employment from 36% to 46% 4 to 6 months after the program was launched. And the results on women's labor force was concentrated among women who were previously out of the workforce before having access to this childcare program. So 4 to 6 months after the program was launched, employment nearly doubled among these women. In follow-up surveys that were conducted 4 to 7 years after this program was first launched, researchers no longer found impacts on mothers' employment. However, they did still find long-term impacts on grandparents and especially grandmothers' employment outcomes. So 4 to 7 years after the program was implemented, this is after the children of 0 to 3 they're no longer in the daycare centers, grandparents were 15% more likely to be employed. And the average age of grandparents in this study was 56. So these people are still well within the working age range. The results from this study suggest that a lack of childcare hindered caregivers' ability to work in this context. And then the program also had lasting impacts on household income the 4 to 7 years after the program was implemented. The next example I'll share comes from Chile, and this was a study conducted by JPAL-affiliated researcher Claudia Martinez and her co-author, where they assessed the impact of randomly providing access to a daily free after-school program to children aged 6 to 13. So access to the after-school care for children increased women's employment by 5% and increased their labor force participation by 7%. And the program had even larger effects for those women who were not working at the baseline and had young children, so younger than school-age children. And among those women, the after-school care actually increased their labor force participation by 23%. And then I think another interesting outcome or finding from this study was that the after-school program also led households to more frequently use a pre-existing free universal daycare service that was for younger non-school age children. So this was a program that existed before the after-school program, and by providing after-school care for the older children, women started to use this other daycare service. Then the third study that I'll share about employment and childcare comes from Kenya. This is a study that randomly provided subsidized early childcare to mothers that were living in Nairobi. And the researchers found that this program increased mothers' employment by 8.5 percentage points. And this increase in employment was really driven by married mothers. So if you look at the bar chart here on the right, you'll see that actually single women decreased their hours worked of their labor supply. And what the researchers found was that offering daycare to single mothers allowed women to actually cut back on working extended hours without any losses to their wage. So they were able to shift to jobs that had more regular hours once they were offered the subsidized early childcare. And then I'll move to the next pathway that I mentioned at the beginning. So besides increasing employment, the other pathway through which childcare may improve women's outcomes is by allowing them to actually be, more focused and productive at work or in their businesses by not having to multitask care. So a recent study that was conducted by JPAL affiliates Salim Gulesi and Laurie Vanderwall in partnership with their co-authors in BRAC Uganda evaluated the provision of childcare subsidies and or cash grants to women in Uganda with children ages 3 to 5 years old. And here the researchers found that on average, mothers increased their self-employment revenues by 47% and their business profits by 29%, despite working the same number of hours. So this really suggests that childcare really did increase their productivity at work. However, the women in this study who had younger children at home, so children below the 3 to 5 year range and were not able to enter into this childcare program, did not see an increase in their business income, which suggests that taking care of young children, despite their older children being in the childcare program, may limit the quality of a mother's time spent in her businesses. And then another finding from the study that I want to highlight is that in this context, a lack of time does not seem to be a binding constraint for mothers' labor supply on average, but this may not be the case for single mothers. The researchers found that single mothers actually did increase their labor supply when they were offered childcare. So in some of the findings here from this study in Uganda suggest that childcare allowed mothers to work more effectively in their businesses. So I'll just wrap up the conversation here with a few final considerations that come kind of from across these studies. So one finding that implementers or policymakers that are considering taking up childcare programs might want to consider is the coordination of care across age groups, and then also consider providing coverage for a standard workday for women. So as I mentioned previously, the studies from Chile and Uganda both found that mothers seem to be constrained by a lack of childcare for children of all ages, not just the target age range that were targeted in the specific programs. And then another important consideration, and one that definitely remains to be studied further, and I think Shelby was also hinting at this in her presentation, were questions around the cost effectiveness of childcare. So the study in Uganda that I just discussed found that subsidized childcare was at least as effective on household income and child development as that of an equivalent cash grant, but we definitely need more research to understand the cost effectiveness of different childcare models. For example, comparing public provision versus vouchers versus employer-sponsored care in order to identify scalable models. And then, as always, we should just keep in mind that women are not a homogeneous group. As I discussed, childcare has been shown to have different impacts for single versus married mothers, mothers versus grandmothers, working mothers versus mothers outside of the workforce. So this is definitely something that we'll want to consider as we think about the impacts of childcare. So I'll wrap up here. Look forward to any questions and discussion, and thanks again so much.
Thank you so much, Megan. And yeah, I do think we'll have a clarifying question for you at the end. It looks like those dropped in the chat, but we'll wait for the Q&A. But thank you for that presentation. I think you brought in a lot of really important features, thinking about the kind of mitigating factors in terms of what will make childcare effective, including, availability of employment, and this kind of social norms factor is really key. I also think you raised something that's important in terms of kind of our broader care agenda is the coordination of different types of care. So you're talking about that with like after school and kind of daycare, but I think there's also, how different care pieces, right? So long-term care responsibilities, other care responsibilities, how we're kind of approaching that holistically. I also really liked this kind of productivity feature. I haven't seen that so much in literature. So thank you for that, Megan. We're now going to turn to Shreya Ghosh. She is a senior policy and advocacy manager at IWWAGE. There, she's responsible for the execution of IWWAGE's policy advocacy strategy to advance women's economic empowerment in India. She's particularly interested in exploring the interactions between policies for women and children to maximize their impact for both. Her experience spans across sectors such as rural livelihoods, school education, and child protection from a gender equality, disability, and social inclusion perspective. So today, Shreya is going to be presenting on a 3-part series of papers that emphasizes the interconnectedness of labor, women's empowerment, and child development policies and programs.
So thank you once again. Let me start from the beginning. So so as I mentioned that IWWAGE essentially focuses on the central question that we look at is the low and declining labor force participation of women in India, and kind of trying to identify the barriers and enablers to that and find solutions to inform gender transformative changes and policy reforms. And oops, it's stuck again. Yeah. So as I said, that the labor force participation rates in India have sort of stagnated at around 24-25%. And in fact, over the last couple of years, say since the year 2005, national labor surveys in India show that it's actually on the decline. And the compounding factors for this decline, of course, there are many, but time poverty that's endured by women and social protection and child development programs, we've seen, especially in this context, which tend to sort of compete with each other, or they tend to clash with one another, which becomes an issue for maternal employment and child development outcomes. So it is in that context that I'm going to be talking about the paper series, and it's essentially an evidence review. And I'm not going to get into the challenges of entering the labor force, because I mean, this group already knows all of that, balancing work with family and the perceptions around, women's caregiving roles. So I'm just going to jump right into the papers. It's essentially an evidence review. And so that's why what we did was that we looked at literature which focused on the impact of center-based childcare or daycare on maternal employment and on ECD outcomes of children below the age of 6 years. For data sources, we looked at
if anyone is not speaking, just make sure and mute. Thank you.
Okay. And we looked at data on utilization and coverage from the data sets that you see on the screen. And we also did one-on-one in-depth key informant interviews, which was specific to the Indian context, as well as stakeholders who were looking at the issue globally. From that, we arrived at a short list of countries, and high income countries actually were shortlisted first, because they were the ones that originally noticed the growing gender inequity in employment, and sort of among the first to introduce these childcare programs way back in the 1960s. And initially, it was a very labor policy kind of an orientation to the program, because they wanted to sort of support balancing family and childcare and work life. And over the years, when there was emerging evidence that these daycare programs also had an impact on child development outcomes, is when the sort of policy orientation shifted. But nonetheless, I mean, there's a very clear, strong focus on short-term and long-term investment in human capital in these countries. For the LMICs, the countries that were selected were Colombia, Chile, and Mexico. We did not really look at Brazil, because even though they have several different provisions for ECD, the center-based childcare model that has been implemented, it's only been evaluated in Rio de Janeiro. So we didn't have the scale that we were looking for. So coming to the first paper of the paper series, so what we tried to look at is that, of course, in LMIC context, the majority of children are more likely to encounter the risk factors that initially Mary spoke about. So these are like, say, poor sanitation, that's and the connected health issues. There's substandard housing, domestic violence. And a lot of these actually risk factors have a high level of co-occurrence, and there are fewer promotive influences for child development. So we looked at center-based care within the concept of nurturing care, which essentially consists of several of these interrelated components. So they look at behaviors, attitudes, knowledge regarding caregiving, psychosocial activities, and responsiveness and safety. And looking at it within this sort of applies across contexts which include family care and non-family care. And center-based childcare is essentially a form of non-family care. And the evaluations of center-based childcare is important because, especially in the context of women in the informal sector, they usually have to rely on non-family kind of care, and they need to leave their children unsupervised, not out of choice. And so what happens is that in the bargain, there's a danger to their health and safety, and children are sort of unintentionally deprived of the promotive influences of nurturing care. And what evaluations have shown for center-based childcare is that the more the marginalized the household, the greater the impact on maternal employment. So when a woman from who's working in the informal economy, who's from a low socioeconomic background, and if she is leaving her children with, say, grandparents or with other community members, the outcomes for children are actually not as strong as compared to when they are availing services in a childcare center. Then the other thing that we see in terms of affordability and price elasticity for childcare, and this aspect actually has only been studied in developed countries. So we don't have much data on what it's like in the LMIC or in the developing economies, but it shows that for developed nations, childcare subsidies have had very positive effects on women's employment. And the third point is not really an impact, but it sort of speaks to the previous point about affordability and availability rather of childcare, is that the preferences and social norms are a very strong driver for childcare, and it's not only about the cost or the availability of childcare centers and services. The other thing that we see is that the impact of childcare on ECD is, of course, that it has long-term impact on children's educational outcomes. It has, it reduces the schooling gap, and it also has long-term economic benefits. So this kind of suggests that high-quality center-based childcare is beneficial for outcomes for maternal employment, for women's employment, as well as for outcomes for early childhood development for children. And so having said that, then I move to the second paper in the series, which focuses on the public provisioning of center-based childcare facilities in some high income and low to middle income countries. And so what you see over here is, on the left, of course, is the high income countries. And essentially, the 5 sort of central policy areas which are common to all these Nordic country models are a generous maternity and parental paid leave, there's social cohesion, universal coverage, financial structures and incentives. And so financial structures and incentives essentially include low monthly fee for services, tax rebates to parents, and subsidized fees. And there's also scheduling flexibility, especially to combine part-time work with leave over a long period of time. And so what happened is that over the course of several years, the governments of these Nordic countries have managed to universalize childcare, and it's been institutionalized as a social right. And of course, this came with sort of decades of efforts to create demand and to change social norms. But as of 2014, the utilization of childcare in Norway, for example, for children within the 3 to 5 years age bracket is as high as 96%. And for children in the 1 to 2 years age cohort is about 56%. So clearly there is a very, very sort of high utilization, and there's a acceptability of childcare programs in the Nordic countries. And compared to these countries, if we were to look at the developing economies, then we see that center-based childcare is a relatively nascent idea. And this is especially true of rural areas or areas which are socio-economically a little less advanced. And so if we were to just look at the models of these countries. I'm not going to embarrass myself by even trying to pronounce these Spanish words. I will go with the abbreviations. So for example, Colombia, the HCB, Colombia has a sort of a rural, semi-urban, community-based model, which with a state provision for with an entrepreneurship component. So the HCB, along with a state-provided and implemented model called the HI, is present across the country. And for the community childcare center, the government sort of provides loans and subsidies to women in the communities to run these centers in peri-urban and rural areas. And for HIs, there are essentially these centers which have been constructed, and the number of children in both these places actually vary quite substantially. But Colombia is an example that has sort of really evolved from a low-cost community-based childcare model to encompass most of the best practices which we talk about in terms of childcare and the nurturing care framework that we saw earlier, while also encouraging an entrepreneurial childcare cadre. So that's something which is interesting about that model. Chile has a center-based childcare model, which is provided through JUNJI. Again, don't want to pronounce these names out of pure respect for that language. Basically, the government sort of oversees end-to-end implementation of the centers. In addition, it also has a certification model where Integra, which is a body which funds, which is funded entirely by the state, but implemented by the non-profit entity. And it's certified by Junji. And Integra serves the sort of hard to reach areas in Chile where the government does not have a direct implementation. When we look at Mexico, Mexico has a few variations in their programs, but what we want to focus on is the PEI, which is a scaled up program, and its primary focus is to support working mothers with children who have children under the age of 4 years. And more recently, there's been an attempt to combine this daycare program with its preschool program, which caters to children between the ages of 4 and 5 years. And lastly, in India, for the second paper, we are not looking at the government provided childcare center so much in detail, because that comes in the next paper. So it does have large scale government programs, but the coverage and utilization is a little low, and the reasons for that we'll come to later. But this paper studies examples of small scale sort of alternative government models, which are affordable sort of quality childcare centers. So if we look at, for example, NGO models such as Seva or mobile creches. So mobile creches has the most holistic approach to childcare. It adheres to age appropriate curriculum, the prescriptions for nutrition, and it also has sort of safety and structural requirements for a childcare center. Seva, on the other hand, is it also sort of engages. It has a very holistic set of interventions, and it engages with universities. But in terms of the early childhood education, it tends to lean more towards the 3R approach, the reading, writing, and arithmetic approach, which is not exactly ideal for young children. But because they cater to a population which is influenced by the sort of private sector schools where you should know how to read and write and speak English, is one of those aspirational things for people from low income families. So that sort of tends to push the education, the preschool education, in that direction. If we look at Pratham is also another very large and well-known NGO, but their focus is largely on the education part of ECD rather than the other interventions around, say, care or health or nutrition. And the private sector players in India, two examples studied are Sudiksha and hippocampus learning. They definitely tend to sort of emphasize the reading, writing, arithmetic, which is not age appropriate. And because, I mean, given its market orientation, it tends to pander to, as I mentioned earlier, the aspirations of the low income parents. I'm sorry. So that is the sort of models that we have looked at in the paper. And we will also sort of come to the kind of um,
So sorry, Shreya, we're a little short on time with the hacking. So if you could try and just wrap this up,
Yeah.
the last paper. Thank you so much.
Yeah. And so essentially what we're going to do is try and see what are the sort of some areas in which we can look at my screen is stuck. Can you see my screen?
Yes.
Yeah. Okay. Yeah. So essentially, we're looking at certain systemic features, and we see that in comparison to the developing countries, the Nordic countries sort of, because they have so many similarities, we've clubbed them all into one group, and we've looked at Colombia, Mexico, and Chile separately. And the minimum kind of time that is available for daycare is much longer than what we have in India. In India, we have just about 2 to 4 hours. There is continuity of care. The Nordic countries provide it as a right. There's a lot of investment in childcare, and the staff ratio is also, compared to developing countries, the Nordic countries have a higher child staff ratio. And all of this, at the end of it, there's, in terms of an impact on the maternal employment rate, we see that there's a increased, sort of marked increase in the probability of mother's employment, which ranges from, say, about 6% to 25% between, depending on the country that we are talking about. And the last sort of paper, which focuses on India, is looking at the largest government child development services that are available in this country. And the ICDS, essentially the key sort of highlights of that paper is that the ICDS definitely has a great potential to serve the dual objectives, but there are certain sort of negative feedback loops which have persisted over time, especially related to human resources, related to the data systems and evaluations, and not really acknowledging the role of mothers as income contributors to the family and to the economy. So the key takeaways that we can think of, I've clubbed it into 4 broad areas. So if we look at governance and accountability, then I think acknowledging the burden of unpaid care work and mothers' roles as a breadwinner while designing ECD policies is very important. And of course, the availability of quality care services and ensuring continuity for child development. In terms of scope of programs, I think what is very clearly coming out is, which we don't have in India, is that the childcare center must be open for the same time that the parents are going to work. And we have certain possibilities of exploring that with other ministries, and sort of testing out what would work best, especially when we look at the entrepreneurship model from Colombia. The other thing is also that there needs to be a very strong social messaging and awareness campaign on how center-based childcare is important, especially because if the mother goes to work, it often falls on the older siblings to take care of their younger ones. And my last slide is essentially on improving data and information systems. And we don't have much evidence on the benefit cost of integrating nutrition and child development programs, especially in the Indian context. And also the Indian context needs to have better sort of structural and process indicators so that service delivery and quality can be improved. And we have a huge shortage of human resources. So I think fixing human resource shortages, There are sort of requirements to delineate responsibilities. Right now, there are just 2 workers who are doing outreach, who are working at the center, who are maintaining data and records. So that is what sort of really creates a lot of pressure on the system. And so, looking at strengthening the human resources and probably having complementary programs for outreach and home-based counseling is something that can be explored. So yes, with that, I sort of come to a close.
Thank you
will
so much,
stop
Shreya.
sharing here. I'm sorry I overshot.
It's okay. There was so many great insights that you shared with us. And, unfortunately, we are a little bit shorter on time because of the hacking issues, but we will probably run a little bit over today for those of you that are able to stay for Q&A, just given that. But I'm going to quickly now just pivot so we can keep moving forward to Asayya Imaya, who is the founder and CEO of Uthabiti Africa, the Nairobi-based childcare organization that exists to accelerate quality, affordable childcare for all in Africa. Most recently, Imaya was the head of international programs at the National Lottery Community Fund and the country director for King's College London Sierra Leone Partnership. Imaya leads Uthabiti's collaborative action for childcare. And today, Imaya will be presenting preliminary data on ongoing operations research that Uthabiti has been undertaking as part of its collaborative action for childcare in Kenya initiative. The research emphasizes the interconnection between women's agency and childcare and highlights the market gaps that hinder the growth of women-led childcare enterprises and offers preliminary recommendations, highlighting opportunities that exist for collaborative action, including on workforce development. So Imaya, I'm going to turn it over to you.
All right, thank you. All right. All right. Thank you very much, everyone. And it's really, really interesting to be here and to represent the collaborative action for childcare in Kenya, as well as Uthabiti Africa. I'll start by giving a brief overview of Uthabiti Africa. We are the leading organization that's working to accelerate quality, affordable early childhood care in Africa. And we've been working in Kenya for the last 2 years to really pilot our initiative. We envision a time where all children 0 to 5 have access to quality childcare, and our focus is really on the carers as the predominant and or really the main interlocutors or the connection between us and children. And I will be speaking about our research, which is really operations research around our childcare workers that we are working with. So the collaborative action for childcare is our main initiative for delivering our vision, and it brings together over 20 organizations in Kenya, government, ministries, and these are connected through technical working groups as well as learning networks that are actually advancing the agenda for childcare in Kenya. So I speak on their behalf and also on behalf of Uthabiti Africa. So we started in 2019, and we were designed by actually a group of organizations across the childcare ecosystem in Kenya. And we identified about 7 key gaps through consultation and some initial research we did in Kenya. And some of these challenges, so we had about a 12-month design phase where we had 6 organizations do a series of in-depth studies across various work streams, and also market analysis that we did. And we identified 7 key problems. And one of them, and why this is really critical, is because this is really predominantly linked to caregiving, which is, as I will mention in a few minutes, really a women-led sort of piece of work. So we identified 7 key problems. The first one was a really poor policy and regulatory environment that gives little or no room for systemic change in laws and regulations across Kenya. And so you would find that a lot of childcare micro-enterprises are not registered, or if they are registered as businesses, which makes it impossible for them to actually meet the cost of registration. There is no training curriculum for women in the childcare ecosystem, and I mention women because a huge percentage of childcare workers are women, and so the childcare is really career of last resort. And I think for human capital development of Africa, it boggles the mind that actually the people that Kenya and a lot of African countries give responsibility to for the care of children actually are not trained. So it really poses huge concerns for the human capital development of the continent and specifically Kenya for this purpose. There is poor pay for women in the childcare ecosystem, not just the workers who take care of children in homes or in childcare centers, and that really means that women generally are getting low pay. And if you look at the spiral effects of that, it means that if children are not getting good quality care, working women are worried, and it has a lot of impacts on the economy. And so it really aligns with what other presenters have said in this meeting. I think the biggest challenge is that there is insufficient financing and resourcing for women-led childcare microenterprises, and we found that organizations involved in women's economic empowerment have actually not reached women working in childcare, and the data that I'll be presenting demonstrates that actually there's a huge need here that needs to be filled. There is insufficient psychosocial support for young women, particularly teenagers who got children, and this again has implications not just for the health and well-being of the young mothers, but also for the health and well-being of the children that these young women are taking care of. There is also really poor coordination in the childcare ecosystem. There's a lot of competition, insufficient resources, and most of the time it's not even clear which government department is responsible for childcare. And finally, insufficient knowledge and understanding amongst parents about the needs of children, and particularly the importance of early childhood care. I think what is not mentioned here is really lack of data for the childcare within the childcare ecosystem. And what we've been trying to do over the last 18 months is really begin to collect systematic data on the childcare ecosystem so that we can begin to use data to influence policy and practice. So we found out over the last 18 months, first of all, I need to mention that when we started this work 4 years ago, I remember being told that there were 3,600 childcare micro-enterprises in Nairobi. And when I asked, where's the data? Where did that data came from? I was told it was something somebody mentioned in a meeting in 2016, and that is what was being used. And when we talked to the government, they asked for data. So what we've been doing as the collaborative is really begin to generate evidence to influence policy and practice. And so far, we've identified that in Nairobi and Kisumu alone, there are 4,277 childcare enterprises, and 92% of these are led by women. And there are 80,000 children under this being taken care of by these women, and just under 2,000 children with disability. The really, really important fact here is that 60% of these childcare enterprises are what we call home-based childcare providers, and they have not received any form of support from anyone since they were established, and some of them are as old as 20 years. And so I think it creates a lot of questions around how projects around women's economic empowerment are designed, because in our experience, the women we see running these childcare micro enterprises are probably the most vulnerable, but the most resilient, because they're offering a service to society, but they're not recognized. One of the things that we have identified, that there are two categories, of course, I've mentioned, there are two categories of women caregivers. 60% of these are home-based caregivers. They're the ones who offer the majority of service to women and families in Nairobi and Kisumu. And the center-based ones are only 40%. And that actually tells you that in terms of the knowledge that we are generating, the biggest challenge we have is supporting women who are offering services from their homes. So as I said—
Sorry, Imaya, I didn't mean to interrupt you. If you could just try and wrap up in 1 minute so we have some time for our discussants. Thank you.
I think that I've already presented that data. The children, yeah, I think majority are girls. That again has implications for gender and empowerment. And I think for workforce, I've already said there's a huge need for building the workforce. And I think in general, in terms of recommendations, I think there's the gap for research, for interventions that led particularly by organizations in the women economic empowerment sphere are huge. And so, and for research particularly, we think we're just beginning to collect the data, and listening to what you are doing here, we would like to collaborate to do more in-depth data on a variety of topics, not just enumerating the women, but also going deeper to really get data that can change the ecosystem for women. What I can say is that the challenge within the childcare ecosystem in Kenya alone is huge. And if we go into Africa, the challenge is even bigger. And I hope that through our engagement in this, we can begin to collaborate more and dig deeper into the childcare ecosystem and support the women in there. Thank you.
Thank you so much, Imaya. So many great insights from that. And I'm going to now pivot to our discussants to go ahead and give their remarks and some connections to advocacy. So first, we're going to be turning to Wangari Kinoti, who's the global lead for women's rights and feminist alternatives at ActionAid International, as well as a WeProsper steering committee member. She is a feminist and Pan-Africanist who has worked in various roles in the national, regional, and international women's rights and social justice arena for nearly 2 decades, including leading work on land rights, unpaid labor, and access to decent work, public services, and social protection. Wangari is actively engaged in Pan-African and South Third World feminist spaces with an interest in contributing to shaping radical, transformative, and caring futures for Africa and beyond. So Wangari, I'm going to turn it to you.
Thank you so much, Mary, and thanks to you, Shelby, Megan, Shreya, and Asayya for presenting your really interesting research. It's really been a pleasure to listen to you and very informative. I know that we're extremely short on time. I was going to say 5 things. I will now say 2. And I mean, so I won't sort of respond to the different pieces of research, but kind of just give 2 general thoughts that I think we need to bear in mind as we continue to work together to advocate for childcare in our different spaces, and indeed for wider care services. And for me, first of all, it's the issue around financing. So we of course know that, well, I'll speak for Africa, today, and say, or rather speak on Africa for today, and say that, for us, and indeed in other regions in the majority world, really the financing question remains sort of key and central, right? So even in our advocacy, we have seen, our advocacy with governments, with regional economic communities, with the African Union, so on and so forth, that this comes up, consistently as a question. So where does the money come from? And so it's great to get, it would be, I think, great, to get estimates on, for example, how much it would cost to provide childcare in X country, and then look at the financing options, right? So domestic revenue versus ODA, what comes from IFIs, etc. But what we should also be talking about is really how much could be, okay, I'm speaking again about the context of Africa, is how much could be recovered from illicit capital outflows. Now, I'm saying this because, I've increasingly found that it's important for us to kind of do cross-issue organizing, right? So, for example, if we were to organize, do our advocacy, so on and so forth, with organizations that are looking at sort of the financing gaps, right? And make the case that if we plug those financing gaps, or rather if we stop, for example, the capital outflows, and I'll explain a little bit more about what I mean in a second, that if we're able to curb that, then that money could go into certain things, including care services, right? So for example, we could, as the African continent, cut half of our annual financing gap to achieve the SDGs by $200 billion, right? If we stopped illicit financial flows. And here I'm talking about illicit capital flight in the form of tax practices, illegal markets, corruption, theft, and so on, right? Because, we're saying, so if you look at, if Africa is losing about 3.7% of our GDP, so $88 billion or so, through these sort of illicit capital flight, when you look at that, it is as much as the combined annual inflows through official development assistance and through foreign direct investment, FDI, right? So you can imagine if we worked on sort of ensuring that we're stopping these illicit capital, this illicit capital flight, then we would be able to raise the money that we're already, sort of relying on through official development assistance and through foreign direct investment. So my point is, and I'm really rushing through this, my point is that it would be really important, especially in our advocacy, for us to ensure that we're bringing together several campaigns. So there's a campaign on curbing illicit financial flows, domestic resource mobilization, and we can combine that with our campaign on care services, including child services, to answer the perennial question that comes to us in our advocacy work around, where does the money come from? So that's the first one, and I've really rushed through it. The second one that I think I would mention is around the issue of public-private partnerships. And I know that Fiana is going to probably come and speak a little bit more about international financial institutions. I want to mention public-private partnerships because, again, just looking for some reason, I've decided to focus on financing. To say that, because we know that this is sort of being pushed as the panacea for our public financing problems. So that, especially when it comes to shortfalls in public service delivery, right? So PPPs, public-private partnerships, will come up a lot. And we see this already with childcare. What I would like us to bear in mind is that there has been quite a bit of analysis from a feminist perspective. I can link some of it in the chat, of public-private partnerships in the Global South. And showing that there are certain things that we need to look out for, right? So first of all, there's the issue that comes up around poor priority setting, which comes at a great risk to public good, of course, and also the risk falls on the public purse. So we know that PPP is really about socializing risk and loss. So the privatized profit, socialize risk and loss. I know that I am generalizing a lot here, but most PPPs have been found to be more expensive in the long run than traditional government investment, right? And they also have had direct impact on women's livelihoods. And you know, so we've seen that for mega infrastructure projects, so on and so forth, which is probably not what we're talking about here with childcare. But PPPs also mean that alongside the economic loss coming from sort of being, you know, having to make out-of-pocket payments, is the reality of the decline in the quality of services. And that decline comes due to the segmentation of users based on the ability to pay, right? So if you pay, you know, the more you pay, the better the service, right? So here we're talking about we're not able to ensure that there's, you know, high quality of services across the board, right? And you know, so, and then what ends up happening is that you have more difficult material conditions, meaning that there is increased, you know, unpaid care and domestic work. So we're back to sort of the first problem in the first place. And also the deterioration of paid working standards, you know, when there's a promotion of casual contracts, so on and so forth. I was glad to hear that Asayya was focusing on childcare workers. So I guess those are the two things I want to say. I've really rushed and I apologize. But for me, it's around what we need to consider in doing our advocacy specifically when it comes to the area of financing. So kind of thinking about how we can link up with groups that are talking about public financing and ensure that the conversation is also leading towards where is the money going. So not only how is the money raised, but what is it going into? And this is where we start to bring in the conversation around care services, including childcare. Thank you.
Thank you, Wangari, and apologies that you had to rush through that. And it would have been very interesting to hear your other 3 points as well. But I think these issues of financing are really key and really critical. As you said, how we're getting the money in other ways. So I appreciate you bringing up that context and your kind of thoughts around advocacy. I'm now going to turn, last but not least, to Fiana Sierra Arbab, who's the current International Financial Institutions Advocacy and Gender Coordinator with Oxfam International's DC Advocacy Office. While she provides coordination support across IFI policy issues relevant to the team's priorities, she's particularly invested in building grassroots and national advocacy capacities to influence the World Bank's new childcare initiative and shift the broader conversation on care infrastructure and systems while keeping her eye on the bank's upcoming gender strategy update. So Fiana, over to you.
Thanks so much, Marian. Actually, Wangari, it's as if we scripted our interventions together, because where you left off is exactly where I'm going to pick up. First, I want to raise questions exactly of where Wangari left us off, regarding questions of not only where we get the financing from, but where the financing is then directed. Oxfam also has evidence demonstrating that when there are fees, no matter how low, certain income groups are excluded, and we cannot maintain that standard of high quality of service provision and care. We have also seen that quality of services do suffer. Low wages are paid to teachers who are also overwhelmingly female. So that's going to be my thematic approach to the rest of my comments, is childcare is a gender issue because the service providers and carers of society are overwhelmingly female and women and girls. We've also demonstrated similar evidence in our findings related to PPP models in the K-12 sector, particularly, which I believe, you know, controlling for some specific factors are extremely relevant and translatable. I'm curious actually to know more about these ROI case studies that CGD helpfully reviewed and analyzed for us. We want to be asking the specific questions of how the childcare investments are made, especially in cases where childcare investments are self-funding or partially funded. Is it funded through public finances entirely? Is it mixed? Or is it mostly driven by the private sector? I want to raise this particular question because particularly with relevance to the World Bank's new Invest in Childcare initiative, the tone of the concept note and the tone of the modeling that seems to be pretty much encouraged throughout the concept, it seems as if this financing is going to be private sector driven, and that it is deeply concerning considering the evidence that's out there. We also want to be making sure that our approaches are context specific. And so really exciting to hear existing models and research from Kenya, from Asayya, for example. The national level questions need to be had and national level advocacy needs to be had, primarily because IFIs, including the World Bank, keep saying that they will follow the lead of governments. And while we know that IFIs do set the tone and standards as facilitators of global financing, there is an opening right now to work with national and subnational level advocacy groups in order to shift the direction of the global approaches as well. I also want to target specifically the gender angle that keeps being referred to in the World Bank's new Invest in Childcare initiative, but also beyond. The gender angle to childcare and care labor should not only be about freeing up women's time and female labor force and participation in the formal sectors. Childcare is a gender issue because of existing social norms. And I know some of the research, that was a gap that was mentioned, but also the fact that caregivers are the most likely to be women and are also the most likely to be poor and racialized women in the global care chain. So it's not enough to invest in childcare only as a social service or for children's early development in terms of learning, nutrition, and socialization. As we also heard from Shreya, in developing contexts, childcare is deeply intimate as a social function, entangled with relationships with neighbors, family, and community. Healthier communities, free from poverty and inequality, are also good for the well-being of children. And so you can't disentangle the two. So I would highly encourage childcare programs, modeled by and led by financiers and governments, should consider how childcare and caring labor requires an interlinking of women's development as well, in terms of fighting women's inequality from a standpoint of striving towards a more thriving society at large, rather than simply investing in childcare in order to increase the potential of women as human capital and productive members of the economy. As related to that, I would encourage us to challenge even this notion of what productive labor looks like and is defined. So oftentimes, phrases like increase in women's labor force participation is an emphasis in the interest of GDP measurements. I would challenge us to think more about women's economic empowerment and also agency being reflected beyond just women having paid labor. Care work is productive labor. It is productive for society. Caring labor, society would not function without the social reproductive function of women and girls in our society. So we need to be asking the questions of, do women and girls have equal opportunity for lifetime opportunities by the 5 R's established by the ILO? So recognizing, reducing, and redistributing unpaid care work, rewarding by providing more and decent work for care workers, and representation, which includes social dialogue and collective bargaining for care workers. For example, as demonstrated by the JPAL study on subsidized childcare in Kenya, we saw that reducing women's overextended hours of labor comes as a direct of a public subsidy on childcare. So, taking lessons learned to be more human is really important. And then also in our advocacy work, how are conversations about childcare for women's economic empowerment also feeding into ongoing movement around counting productive labor outside of and beyond GDP? So there are conversations really exciting about alternatives to GDP as well that maybe we should keep in mind. And then 2 more really quick things, second to last. It's also about choice. What happens when women or men want to stay at home and be carers? Is the vision of our future for everyone to have formal wage earning childcare jobs? Public provision of childcare as a component of social protection would enable empowerment and liberation for people, no matter what class or income status, and the ability to choose what to do with their lives. And I want to emphasize that without care infrastructure, choices are being made for people due to economic and time-based restraints. And lastly, it's clear that access to childcare has extremely complementary benefits across the care sectors, which include elderly and disability care, which truly demonstrates the importance of approaching childcare through a broader care infrastructure lens. So asking, how are we developing and advocating childcare models that address these intersectional issues and in transformative ways? You know, when we talk about high quality childcare and nurturing frameworks, they should include consideration of the regulatory environment in each country in order to protect labor rights and provide safe, quality, and accessible childcare services. Thank you.
Thank you so much, Fiana. So many really great points made in there and things for us to think about in our advocacy. And, want to put out the call. I know we've, lost quite a few people, have had to drop off, but, for those who are doing advocacy and research at the national level, there is, as Fiana said, I think an entry point, particularly within the World Bank's current efforts. But we are over time. However, I want to give the opportunity if there are any who want to kind of respond to any of these things, bring a question in, any kind of thoughts. I'd say we can go to, have time to kind of do that at the end of this session if there's anyone who wants to raise a question or point of discussion. Or if any of the presenters have any things they want to respond to from either of the discussants as well. Well, I'm not seeing any hands. Did I miss anything in the chat? It looks like Wangari. Oh yeah, Isabella, go ahead.
Hi, I just have a question for the study that compared India and some Latin American countries with the Nordic countries, and especially the observation that women's labor force participation rates have declined over the past few years. So even though I think it's quite true for the Nordic countries, I was wondering whether when you did your analysis using the OECD and other databases took into consideration that the definition of employment used by the ILO has changed in 2015. And since then, progressively, countries have been implementing it. So not everyone has even implemented it now, but the implication of that for countries where agriculture is an important economic activity is that all production for subsistence purposes are excluded from the definition of employment, and previously it was included. Now that change in definition actually resulted in significant changes in employment statistics. And some of the older databases have not yet adjusted their figures for, I would say, if it was accepted by the ILO in 2015, maybe the earliest measurements published were 2018. So for many of the databases, the data wasn't reanalyzed using the new definition, meaning that you will have some employment or labor force participation rate figures, which include subsistence food production as a employed, category of employment. So my question is just, have you taken that into consideration when you compared, for example, Colombia, India, and so on, with the Nordic countries? Clearly, this is not an issue in the Nordic countries, but it's an issue, especially in Africa, India, and in parts of South America.
Yeah, thank you for that question.
Shreya, did we lose you?
I think she's frozen.
Okay. Well, seems to be the theme for the day has been a lot of difficulties, technical and otherwise. We'll wait for her to see if she can be kind of join us again. But yeah, Wenjiku.
Thank you, Mary, and kudos for standing up throughout all the interruptions. Just a question. I come from Kenya, and here a lot of things that the government does requires evidence to show that it is worthwhile in terms of financing. And I'm just wondering, how can researchers quantify the productivity of children in the future so as to encourage governments to support or to finance childcare now, in a sense, because they would have to do it, they would have to look at the productivity in projection, but the childcare is needed now. And the reason why I think this way is because when we were putting together the sexual offences bill, when we were looking at bills to support provision of sanitary towels, the legislator, who is now a senior judge at the High Court of Kenya, Honorable Njoki Ndung'u, actually put into maths what it costs every husband, every father to buy sanitary towels for a family of just 2 girls and a wife. And the bill
Wanjika, I think we lost you now as well. Your audio, I'm not sure. Oh. I think we're losing you, unfortunately.
Need to now show them how the
I think that we lost your last point, but I do want to see if there are those who want to kind of this respond to any of the kind of first part of her kind of questions / comments. Anyone who is working on the kind of, Shelby, I don't know if you have any thoughts, or Megan or others.
Yeah, hi, actually, just to respond quickly, as part of our review, we identified at least 3 studies that included sort of future earnings of children later on as a result of childcare investments. I think we've got them from the United States, from I think Nicaragua and Colombia as well. So I'm very happy to share those papers if those are of use.
Great, and it looks like, I think Imaya, you were going to jump in too, but I was going to highlight a question in the chat you might want to respond to as well, and that's how would daycare work, like the work that you're supporting, support work for rural extreme poor women?
Yeah, in our engagement with government officials, actually the argument around the human capital potential of good quality childcare now, I think resonates very well with almost every government official, and so I think there's recognition that the first 1,000 days are critical, and so we haven't faced any resistance in regard to that. But I think there's value in presenting that data to government officials. But so far, we found that government listens more when you actually present the data in terms of the benefits to the local community. And I remember speaking to government officials in Kisumu, and you could see the eyes of the government officials light up when they actually realize that what they are doing is really important for the future of their community. And I think there's no better message in terms of advocacy than actually emphasizing on the importance of the first 1,000 days to the human capital development of communities, societies, and countries.
Thank you so much for those comments. And I think, oh, Brett, did you want to jump in quickly?
Yeah, I'm so sorry. I didn't. I apologize. I didn't get an updated link, so I missed some of this discussion. I'm terribly sorry. But I saw the beginning, and first, let me just say. So, by the way, I'm Brett with ECDAN. Hi, everybody. Thank you for inviting me to join. I was really impressed with what I was able to see and excited because we know that there are real research needs. But also a wealth of research out there. And so it's up to us as civil society, as global civil society organizations to get that research out to you. And so we're really interested as you know, ECDAN has communications platforms. We would love to have all this research being pushed out through our platform. So please send it to me. I'll drop my email in the chat. But we'd love to help get this out to you to different audiences. And so the other thing I would just say is, I know I'm sorry I missed the earlier part, so I'm a little bit out of the discussion here, but very much, you know, ECDAN is dedicated towards sort of building these bridges between early childhood development partners and gender equality partners. There's such tremendous opportunity, I think, there to sort of build those bridges and come up with a shared narrative. And so really excited about what that will look like. And you know, as part of the work that we do around childcare, we really want to lift up the work that is happening by all of you. And so I hope that we continue to have these conversations so we can do that. I think that's ultimately what's most important, is supporting the work at the national level, and very much committed to that, whether it's securing resources, whether it's developing tools. We'd love to talk about this further. I know we're pressed for time probably, but really want to do everything that we can to support the advocacy that's happening at the national level. And for those of you who, I don't know if you touched on the World Bank event last week, but there is an opportunity with the World Bank right now in their Childcare Incentive Fund, but we need to make sure that civil society is at that table and part of the decision-making process. And that's critically important because there's concerns that conversations are happening between the government and World Bank in your countries, and civil society may or may not be aware of those conversations. And so we want to ensure that we're all at the table together, and that the voices of diverse communities are involved in that conversation and the policy development. So sorry, I'm a little bit out of it here, but would love to continue to learn from all of you and work with you.
Thank you so much, Brett. I think though you weren't there for all of the discussion, you brought in some really amazing points and some great notes to leave us on. I think, you know, for those of you who persisted to the end, I'm really grateful. I think this was a call full of many ups and downs and technical issues, but at the same time, you know, there is so much good and so much substance that comes out of this, right? And also this perseverance. And this is such a critical issue. There is so much moving at the global and national levels on this. And I think, you know, there's a lot to bring in terms of what is the research showing us, but also some really, really critical points about framing that were raised by our discussants about how are we approaching this in advocacy? What are the kind of bigger questions that we're asking around value and how we're valuing work and thinking about measuring progress or kind of what we're even, you know, fighting for? And I think within this coalition, we've set out in our mission and vision, you know, a very broad approach, right? We want to be really focus on these kind of key structural issues and this kind of framing and these intersectional dynamics. And so I invite us to, you know, think about these things. I think this was the beginning of a really great conversation where we're bringing these kind of technical research pieces together with these really kind of broad framing and then specific questions around how do we pay for this and how do we finance it. So I hope that we can take this discussion forward, as Brett said, is I think there are a lot of entry points and openings. And I think, you know, hopefully we can have perhaps another discussion going forward that is advocacy specific around childcare, but I'm also looking forward to further research salons in these series. Hopefully we'll have many lessons learned in terms of some of the technical and waiting room issues. But I think there's a really great opportunity within this coalition, as I said, to utilize the amazing research that is being done and connect that, right? How do we really begin to have these conversations to connect the dots, to make this research policy relevant and to make our advocacy evidence-based? So I'm going to leave it there today, but I think there's a lot of pieces that we can follow up on. Thank you all so much for your support and for staying with us throughout a little bit of a rocky session, and we will be in touch with some follow-ups, but thank you all.